Hello, my name is Dr. Cory Hussain, and I am an infectious disease specialist here at The Ohio State University. My talk today is going to be about fecal matters. So let me tell you about this patient that I saw 3 months ago. She's a 21-year-old lacrosse player who had actually cut her hand in one of the games, and it subsequently got infected. She presented to my clinic with an infection, and I gave her an antibiotic called amoxicillin. She took this antibiotic with subsequent great improvement in her infection, but 3 days later developed this horrible diarrhea. Not your just regular run-of-the-mill diarrhea, but diarrhea enough to fill 6 1-liter Coke bottles in a day. Sensing something was wrong, she went to the emergency room where she was diagnosed with a condition called Clostridium difficile colitis, or C. diff for short. So what exactly is Clostridium difficile, or C. diff? Well, it's a bacteria. It's found in the environment. It's in the soil. It's on different surfaces, and it's even in your food. When you consume this bacteria, it tends to colonize your gut. It actually lives there as a commensal, but when it does cause an infection, it causes severe colitis, which results in this horrible diarrhea that you saw. So, if you have C. diff in your gut, why aren't we all running to the bathroom having this horrible diarrhea? Well, it's not the only organism that lives in your gut. Our gut has billions of other microorganisms that live in harmony with us. These organisms are competing directly with the C. diff for nutrients and for space. And as a result, the C. diff is kind of dormant. It really doesn't do anything. However, if you take an antibiotic, this antibiotic completely upsets that balance and eradicates a lot of these beneficial bacteria that are actually found in your gut. As a result, the C. diff then starts multiplying at an uncontrollable rate and starts exerting its effect by producing a toxin called toxin A and B, which causes this severe colitis and diarrhea in your system. So you ask yourself this question. Well, where is C. diff? Where is it causing these infections? As you might be aware, Clostridium difficile is an organism that lives a lot within hospitals and nursing homes, places where we treat people with a lot of antibiotics, sick individuals. However, in the past 1 decade, we are starting to see an alarming number of cases of C. diff infections in the community. People who have never ever stepped a foot into the hospital are getting C. diff. In fact, this problem has become so severe that in 2011, 453,000 cases of C. diff happened in the United States, with 29,000 deaths at a cost of $4.8 billion to our healthcare system. So you ask yourself another question. Horrible disease, how do we treat it? Well, we treat it by giving antibiotics that actually kill C. diff. These antibiotics are effective against C. diff in about 70 to 80% of the cases. 20% of the patients do not respond to these antibiotics, in which case we actually have to do something called a fecal transplant. It literally is taking pre-screened feces, someone else's poop, and putting it in your colon via colonoscopy. The idea with either treatments is to reestablish that balance, which I showed you before, the billions of microbes that live within your gut that start competing again with the C. diff, and as a result, cause resolution of the C. diff infection by making the C. diff go back to a dormant state. So that's treatment. I want you to start thinking about this problem in a different way now. What if we did not have to go to treatment? What if we could actually prevent this disease by actually maintaining this microbiome that we have in our system, preventing the C. diff from taking hold? Well, in 1907, Elie Metchnikoff, a Nobel laureate, hypothesized and coined the term called a probiotic. He actually hypothesized that if you took enough microorganisms or consumed them, they actually benefited to you in terms of creating a milieu in your gut that was beneficial to the individual that was consuming these probiotics. This has led to multiple probiotic foods that we find in our everyday life. We have yogurt. We have kimchi, which is consumed in South Korea. We have tempeh, which is a fermented soybean product. We even have miso soup in Japan. And of course, kefir, which you can find in the dairy aisle. There's also now commercial products that are available that are probiotics at all. What these are microorganisms that have grown in the laboratory in a commercial preparation capacity, and then they concentrate these by freeze drying them and packaging them into nice capsules or powder that you can take. These probiotics can actually be found in the probiotic aisle. You might have seen some of them. They are supposed to be extremely beneficial because they're in very high quantities and extremely concentrated forms of bacteria or yeast that you can consume. Scientists also thought that if this is possible with such a concentrated dose of probiotics that humans can take, this could actually benefit them from preventing C. diff. So they have taken these commercial preparations and done numerous studies, over 100 studies, to see if these commercial preparations can be used to prevent C. diff in individuals who are at very high risk of developing C. diff because they're taking antibiotics. Well, the studies, unfortunately, have had mixed results. On the right, you see where it does not matter if you take a probiotic. On the left, you see where it does matter if you take a probiotic in preventing C. diff. And the results are all over the place. They're actually on the left where it favors it, or on the right where it doesn't favor it. And so scientists have gone back to the drawing board and started scratching their heads and going like, well, what's going on? You're using the same probiotic, using it in one study it works, and another it doesn't. So let's go back to the drawing board. Let's go back and think about C. diff. As you remember, Clostridium difficile, bacteria that lives in your gut, causes this infection called Clostridium difficile colitis. But it's not the only bacteria living in your gut, remember? There are billions of other microorganisms that live in your gut that actually control C. diff by making it dormant, by not allowing it to compete and overtake our system. So why would you want to use a probiotic that's only one organism to begin with? In fact, the concept of an ideal probiotic needs to have a diverse microorganism milieu. It needs to have multiple different microorganisms that actually populate our gut and reintroduce that microbiome that causes the C. diff to stop producing the toxin, causing the inflammation, causing the infection. The other concept I want to introduce is the concept of a matrix, a supporting matrix that can support these microorganisms that you're consuming, that can feed off a substrate and continue to multiply within your system. Is there such a probiotic in nature? There is. It's actually called Kefir. Kefir is a probiotic that exists in nature and has been produced for many years, and in fact was described in the Russian literature in 1884, but was being even used before that. It hails from that region, being made with Kefir grains. These are grains that have been added by people for hundreds of years to milk products in order to ferment the milk product to produce this effervescent drink that is drunk by millions of people within the Eastern European region for health benefits and health effects. What exactly are these Kefir grains that they're adding to the milk to make this drink? They're translucent little grains that you can find. They're actually composed of lipids, sugars, and proteins. And within these grains is a matrix that supports a lot of bacteria and yeast that live in harmony together as they consume this matrix and live off of this matrix until you add it to the milk, at which point they start fermenting the milk to produce this drink called kefir. If you took these kefir grains and were to actually dissect them, under the microscope you would find multiple organisms, and if you were to grow these organisms within the laboratory, you would actually find a host number of species and genuses of different bacteria and yeast that are living in harmony and symbiosis within these grains, and then actually consume and multiply within the milk that you add them to produce this beneficial drink full of different microbes that you can then consume to repopulate the microbiome in your gut to prevent C. diff. So this is what I am doing about this condition. I want to go back into the community. I want to go to those individuals who have not stepped into the hospital, who are not extremely sick, who are your general everyday people like us. I want to then follow these individuals within these clinics, like the family practice clinic, where they go in for their checkups, and introduce this concept of a probiotic, the kefir. Make it part of their general health, like you would tell, do your exercises, eat right. I would tell them, well, drink kefir. Follow these individuals for a period of time to see what percentage of these individuals would actually be exposed to antibiotics. And within these individuals, see, with this exposure of antibiotics, because they're within our healthcare system, that these individuals, if they went on to develop C. diff infection. Ladies and gentlemen, C. diff is an urgent threat according to the CDC. It causes immense pain and unnecessary suffering at a huge cost to our healthcare system. It is something that can easily be prevented. It is a direct consequence of appropriate and inappropriate antibiotic use. It is something that we can address today by creating a favorable environment where we can prevent C. diff by using a probiotic that could actually work to prevent C. diff in individuals like you and I. This is one infection where prevention is so much more effective than a cure. Thank you.